Now I would like to talk about a problem that most people do not dare to talk about. And this is hypersexuality and Parkinson's disease. What is hypersexuality? Actually, we are talking about uncontrolled desire to have sex. And in the last few years, research has even found out that in Parkinson's disease, we have a accumulation of a few behaviors that act similarly, like hyper shopping or doing excessive shopping and gambling, and sometimes even walking about, going and coming back and going and coming back, and the hypersexuality. Now, the problem that all of them belong to one kind of disorder, which is impulse control disorder, meaning that if usually we have here in our front brain some red light which says, no, stop, let's say that I see a good cake, and I always want to eat all of the cake with the cream, with everything around, but something says here, stop. And usually after 1 or 2 or 3 slices, I will stop. But in some people, a minority of people with Parkinson, probably due to the treatment of the disease, or maybe because of changes of the disease, the control does not function. And then we have hypersexuality, meaning a desire to have sex all the time in very high frequency. But I have to warn you from one mistake that many of us make. And this is the mistake of making, I would say, mixing two different behaviors. One is normal sexual desire, and the other one is the hypersexuality. And I want to explain it to you, because you have to understand the changes that happen. Let's say that we have a couple, a man and a woman. And let's say that this couple is married with good sexual life and with good sexual desire, and actually their desire match together and they function really happily. And let's say that the man started having some symptoms which make him feel not good. It does not feel good. They still do not know that this is Parkinson. But when people do not feel well, they don't have desire to have sex. They don't have desire to have vacation. They don't have desire for many things. So then both of them reduce the frequency of their sexual activity. And then after some time, they go to their neurologist. And the neurologist gives them the news, which is very devastating. And he says, you have Parkinson's disease, he tells the man. Now, just listening to this news and thinking about the future, especially if you are a younger couple, and you know that sometimes Parkinson is diagnosed in people at their 40s, sometimes at their 50s, when they are still young and active, and the understanding that they have to cope with such a disease decreases their desire. But then something happens. The man goes to the doctor, and sometimes he meets a nurse, and sometimes he meets a speech therapist, and sometimes a physiotherapist, and suddenly the man learns that he can have a lot to do with his Parkinson in order to slow it or to make it more comfortable for coping with life missions, and he is more optimistic. And sometimes he gets some treatment or some medication which make him really feel good. And for some men, they just regain their previous level of sexual desire. But the spouse, which is nearby, did not get this treatment. And she did not get any advice. Sometimes she didn't. I hope that you spouses do get some advice. But when you look at the future and you know that you will have to take more tasks from your daily tasks, and you will have to deal with a person which copes with the disease and is less independent, then sometimes the woman does not regain her previous sexual desire, meaning that now we have a couple with unmatched desire. This is not hypersexuality. And in many cases, couple would come to me, or sometimes the neurologist call me and say, I have a problem with a hypersexuality. And I say, check more thoroughly and listen to the story of the couple, because sometimes it is not uncontrollable and the man controls his sex. He just wants to show and experience his love to his spouse, and this man would like to be intimate with his spouse. He doesn't want to give up a very essential part of his life quality. And what we have to do is to assist the caregiver, to assist the spouse, and really find how we can help the spouse coping with all these missions and new tasks, and maybe with the anxiety that spouses feel when they have to cope with Parkinson and they don't get the proper advice. So this is not hypersexuality. Hypersexuality usually happens when some of the men take too much of the dopamine agonist. Some of them really abuse dopamine agonist. And if you are a spouse or if you are the physician, you probably notice it, and we have to take care of it. Because when hypersexuality is uncontrolled, then we have to give medication to control it. We have to give medication to control it in order to protect the person with Parkinson, but in order to protect also the caregivers from sexual harassment or from improper sexual behavior that sometimes you will not notice it. Now the same goes to gambling, for example. And if you as a caregiver notice that your spouse with Parkinson is using dopamine agonist in levels higher than your doctor is prescribing, and you see that the person with Parkinson kind of arranged for him a private supply of a lot of medication, this is a risk sign, this is a risk factor. Tell the doctor about it in order to prevent really problems which can risk your family fortune, even sometimes risk the person with Parkinson legally, and we can protect it. So all we have to do is just talk about it. So if you have one of the problems of the dopamine dysregulation syndrome, like hypersexuality, like shopping too much, like excessive gambling, like going around with no purpose, or any other behavior, share it first. Talk to your partner, but share it with your health professional staff.